Light on the challenges faced by health workers during this period of COVID-19 pandemic. Let's cross over to Parliament and listen in.
Workers, no matter where they work, must be covered. The proposal we have seen that talks about civil servants, it is discriminatory in a way, because we have doctors who have been employed by the county governments from 2014 onwards, who are not being regarded as civil servants. And therefore, from the proposed compensation and cover, they seem to be left out. And that is what the country is not being told. On the issue of counties who are preferring private medical insurance, we are all Kenyans. And we know the reason why they are doing that. They are getting kickbacks from those medical insurance, and that's why they are avoiding NHIF. And our recommendation is monies meant for NHIF cover for the public officers should be remitted directly from Treasury. Because we are in one country, this money comes from one exchequer. These counties don't generate their own money. This money comes from the taxes Kenyans pay. And we urge this Parliament to legislate and make laws which enable Treasury to remit this money directly to NHIF without it going through the county governments. If we want to save the public officers, you want to address this problem for once and for all. Because you will force these counties today to remit. Another government who comes on board next time will refuse to remit. We shall be back here again, 5 years, talking about the same thing. And the permanent way of solving some of these things is putting legislation which has that particular solution I've talked about. We are even seeing some county governments having received COVID fund from the national government. They are, instead of procuring PPEs for the healthcare workers, they have used this money to build markets. They have used this money to issue bursaries to students. Why are they doing this? For political purposes. Because when they build a market, there are votes there. Markets will be seen. They can tell their voters, this is what I've done. Give me another term in office. If they buy PPEs, are using in the hospital, nobody can say that. Why are they giving bursaries? They can say in this village, in this ward, I helped this number of households, and therefore you owe me the votes. That is the sad situation. A good example is Mary County, and I can't fear to mention. And our recommendation to this committee and Parliament carry out audits on the utilization of these funds that they were sent to counties.
Well, 10 people are